James, just a few introductory remarks. If you can tell me who you are and what you do and where you are.
Sure. My name is James Suliburk. I am a general surgeon. My clinical practice involves trauma surgery and acute care surgery on an emergency basis, endocrine surgery on an elective basis, and I am at Baylor College of Medicine in Houston, Texas.
Wonderful. You know that we're doing this interview because I needed to ask you about burnout. So
Yep.
In your mind, how would you define burnout?
Burnout, I think, is best defined as stress that becomes the stress that is generated by whether it's intrinsic or extrinsic forces on a professional that causes them to have lack of motivation, lack of satisfaction in their job, and can then cause the person to have poor performance and poor behavior at their job, which leads to further dissatisfaction and further frustrations.
Well, thank you. That was wonderful. I guess that's the definition that everybody's going by, which is, we've looked at it from all different angles, and I think the American College of Surgeons has a rather keen interest in burnout.
Yeah, ACS is very interested in burnout. A number of online surveys, whether they're administered from Medscape or from any one of the different professional societies, has identified burnout that probably is rates of surgeons feeling burnout exceeds 40%. Depending on which study you look at, it may exceed 60% for different surgeons, whether they're surgeons in training or surgeons in practice. But the rates, a good ballpark figure is that I say 1 in 2 surgeons is currently experiencing or has recently experienced burnout.
That's pretty amazing. I mean, if we think about it from that standpoint, and with all the consequences of burnout, as you have mentioned, I mean, ultimately it's, we lack of skills, if you will. It dulls our skills, and then we have less adequate performance as far as clinical skills or even cognitive abilities, and ultimately the translation is poorer healthcare.
Yeah.
I know you've been through a lot of these things as well as conferences. What do you think is the best approach to kind of tackle combat burnout?
Yeah, so I think number 1 is recognition. And a lot of times, especially I think surgeons are especially prone to this, is surgeons usually say, you know what, I'm tough, I'm mentally strong, I'm going to keep pushing through it. And so denial is really pretty big. And burnout is something that most commonly, when I have either experienced it or I see colleagues who are experiencing it, I think it sneaks up on you. And so I think step 1 is clearly early recognition. So step 1, early recognition. Step 2 is then, once you've identified the problem, we need to intervene on it. And depending on the severity of the stress, it can be anything from just talking with peers about, who have experienced similar things, which I think is always an excellent resource. The problem is that a lot of surgeons don't have peers that they feel comfortable talking about. And so if you're not professional peers, sometimes people can confide in their spouses, their partners. But I find frequently that that's kind of inadequate. Of course, there are healthy lifestyle things you can do. That is, if you got really stressed out and you're on the verge of burnout, you used to work out and exercise, getting back control of that schedule, reintegrating your exercise programs and your health and wellness programs for yourself can help. But I think in the severe forms, it really actually does require a professional level program that is targeted at providing the tools that the physician needs to recover. And if that's not done, it can have disastrous consequences for that physician's career.
You hit the nail on the head. There's a lot of fear of being judged by peers. I mean, if we go out and say, hey, I think I'm burnt out, much like any mental health issue, people are going to look down on you, say, okay, you know, this person is not cut out for it. So you get hesitancy, and then things just escalate from there. With that being said, do you think that, which level do you think burnout should be implemented as far as prevention or screening or intervention? We know that a lot of the literature says it starts in medical school and continues and escalates throughout the year. So do you think that it's a good idea to start early on or later on? What do you think?
Yeah, so, I think that medical school is a good place to talk about it in regards, and I think that, as a component of medical school curriculum, I think they do need to have health and wellness sessions, because doctors and actually probably everybody in the healthcare profession are notorious for taking poor care of themselves. And that's just something that's kind of the elephant in the room, is we're really good at giving other people advice, but we're pretty bad at taking our own. So I think that, you need to have a curriculum in med school. The issue in terms of graduate medical education as well as in professional practice is that the institutions typically do not have budgeted resources to offer appropriate interventions. These things are costly. Professional level programs cost money, and in a time where there are constant strains on both medical school and hospital budgets, it is frequently difficult to find funding to have good programs. You really do need to have visionary leadership in those institutions, whether it's med schools or hospitals, who recognize the importance of these type of programs. If the physicians are better at taking care of themselves, if the health and wellness of the physicians is better, they're going to take better care of their patients. They're going to be more productive members of the healthcare team. They're going to be more pleasant to work around. And your overall morale and energy of the institution will get better. One thing I have noticed is that burnout is actually contagious. And it's every bit as contagious as the flu. And you've worked at places where you just kind of looked around and you said, man, everybody in here is the same way. And you just feel the life force getting sucked out of you every time you go to that meeting at that hospital or that school or whatever. Burnout is just as contagious as the flu. And so I think that, for leadership, they need to recognize it and take strides to have resources in place for people who work at their institution or people who are in educational programs at their institution to avoid this.
Well, you're talking about visionary. What we have noticed is that, and I think people focus on the short term. Oh my God, that's going to cost this much, for example. But the return on investment as far as physician retention, as far as morale, and then you know that it's not patient care, it's patient customer care now.
Yeah.
So your HCAP scores and your Press Ganey scores and everything that says, hey, the physician was nice, is going to reimburse you. And it pretty
100%.
much, if you are upset for the day, rather than use another word, you're not going to get reimbursed because you're not going to get good reviews. So it's really it's like we preach, okay, so invest in your health, but nobody has time to invest in their health.
Right.
So
you don't have time when you got to see 20 patients at the 10-minute visit mark and you got to get it done by 11:30.
Yeah, before you do 7 surgeries a day or something. Yeah. One last question. Have you heard of emotional intelligence?
Yeah.
Okay.
So, emotional intelligence is actually it's relatively new to surgery. In fact, you could pretty much guarantee that anybody who went into surgery 20 years ago failed the emotional intelligence quiz. And
the word emotion stops. It's like, what?
Yeah. But this is something where EI is absolutely more important than IQ. So your EQ, or your emotional quotient, your emotional intelligence, is much more important than your IQ in today's modern world. Everybody, when you get up to this level, everybody's smart and everybody works hard. But the people who really succeed and really know how to function well in the workplace, in the hospital, in the clinic, are people who have very good levels of emotional intelligence. And they are going to be your most productive members of the team. They're going to be your best leaders. And if there's one thing that I myself work on, I try to spend at least every day trying to work on my emotional intelligence, whether it's trying to read something or trying to analyze my day and how I could have done better in that regard. That's something that I actively give myself 30 minutes of time. And it's just one of those things where I've got to have 30 minutes to 45 minutes of workout time. And I make 30 minutes of time at some point during the day to work on my emotional intelligence as well.
Here's the challenge. If we have to take everybody, and I mean, you run the perfect model as far as mind, body, and soul. So if we have to bring everybody on board, whether it's surgery or emergency room or anybody, we have to teach or increase the awareness that, hey, first recognize it, and then you can use EI and how to use EI. And I think that's the challenge moving forward.
Yeah, I think all it takes is just one example. And I think everybody can look in their, last 2, 3, 4 weeks of a case where they had compassion fatigue.
Mm-hmm. Yeah.
And, these are high stress, high risk environments. The healthcare environment, in fact, healthcare as an industry has the highest number of on-the-job injuries, according to OSHA, far exceeding logging, offshore fishing, whatever you think of it, the oil rig industry, whatever you think of, and they're more than twice second place. It'd be even higher if you looked at the psychological catastrophe of people who end up with borderline depression and clinical DSM diagnoses as a result of these healthcare stresses. And I think we all have compassion fatigue that creeps up on us at some point each month. And I think one great way to reach out to physicians is to say, hey, I think that's some compassion fatigue there. Why does that work? Well, because you're able to advocate for taking care of the patient. And ultimately, physicians got into doing what they do because they really do like to help people. They really like to help patients. And if we can point out to them where they may have had some cases of compassion fatigue, which is super common, happens all the time, whether it's physicians, nurses, physical therapists, anybody in a healthcare team. We can say, hey, we could have done a better job there. How can we do a better job? Let's work on our emotional quotient, our emotional intelligence, and that'll kind of bring it full circle to them. And I think when you point out that those cases of compassion fatigue, which we all know exist really on a daily basis, whether in a major healthcare system, we can sort of bring it full circle and really make folks connect.
I think it translates to our own families.
Oh, absolutely. Let me tell you, if I don't work out and I don't spend 30 minutes with myself, my wife does not like me. If there's one thing you can say, is happy wife, happy life.
Absolutely, yes. Yeah. Okay. Well, James, thank you so much for taking the time. I really appreciate it.
My pleasure.